out of every 4 Nigerians, three three has never seen a dentist before. Most people usually feel like I don't need to see a dentist because I don't have any dental issue, and that's very wrong. A lot of people actually have bleeding gums. When they brush their teeth, they'll see one form of bleeding. You don't see blood particles. That's also a sign that you need to see a dentist.
Think about the last time you felt a tiny twinge of pain in your tooth. Did you schedule a dental checkup? Or did you reach for the warm salt water, switch to chewing on the other side of your mouth, buy a painkiller, or you just hoped it would magically disappear? In Nigeria, a toothache isn't just a medical issue, it's a financial calculation. While millions of us brush every morning, the reality is that professional dental care has quietly become a luxury that only a tiny percentage of the population can actually afford. We are facing a silent crisis of missing teeth, untreated infections, and traditional remedies that might be doing more harm than good. Today, we are looking past the standard brush twice a day routine to expose the real cost to keep a smile in Nigeria. Welcome to First Take by First Daily. I'm your host, Omotayo, and here with me today is Dr. Farouk Adebi. He's a brand influencer, a product manager, and a dentist. He's also the founder of Smile Royal Dental Homes here in Lagos. It's a pleasure to have you here, Dr. Farouk.
Thank you for having me.
So for many Nigerians, an optimal dental care is basically brushing twice a day,
Yeah.
Flossing once in a while, tongue scrapers and mouthwashes.
Yeah.
So the question now is that all there is to dental care, or there is more to dental care?
So I'll start by saying there is more to dental care, and I will try to break it down into two. I'll start with every single thing that goes into your mouth has something that has to do with your dental care. Because you can't just say you're brushing your teeth twice daily, you're flossing, and you're putting out, you're always putting several things into your mouth. For example, let's say you're someone that anytime you eat turkey, you like breaking those bones. Those bones can fracture your teeth. At the end of the day, you would have several dental issues. Also, you're someone that you like taking a lot of soda. So much soda can also result in you having dental sensitivity and even toothache at the end of the day. Then the other aspect of dental care is the fact that you always need to see a dentist for a checkup every 6 months and also for a routine cleaning and polishing. Most people usually feel like I don't need to see a dentist because I don't have any dental issue, and that's very wrong. You should see a dentist every 6 months for a professional cleaning. It's called cleaning and polishing. The purpose of that procedure is to take out what we call plaque and calculus. So when we brush our teeth, what we take out is plaque, and we can only take out, let's say, 90%. So it means that there will always be 10% that will be there every single day. So those 10% they keep on building up, and they become what we call calculus. That's what we call a plaque that is not very hard. That even if you use any kind of toothbrush, you cannot take it out. So when you visit your dentist for scaling and polishing, they take those things out. So that's why you need to see a dentist every 6 months.
All right, like you said,
Yeah.
if you don't have a dental issue,
Yeah,
some people say even if you don't have a dental issue, you have
you
to
should.
see.
You should. Yeah.
But are there symptoms to look out for before going to a dental care, or it's just a routine thing, like normal health care, like you want to
Yeah.
go for your overall checkup?
Yeah.
Is that the same case for your teeth as well?
That is supposed to be the same case for your teeth. Most people don't just want to go to see a dentist because they feel like when I go, I'll spend money and I really do not need it. And you don't have to wait for signs. Yeah, there are signs that yes, you know that yes, you need to see a dentist. Signs like which is obvious, toothache. Nobody's going to tell you you would have to go there. And the other signs are you having bleeding gums. A lot of people actually have bleeding gums. When they brush their teeth, they'll see one form of bleeding. You don't see blood particles. Sometimes you see it, sometimes you don't see it. It comes, it goes. That's also a sign that you need to see a dentist. So you don't have to wait until when you have those things before you see a dentist.
Okay, it's not a situation where sometimes some people brush really hard.
Really hard, yeah.
Should that warrant you going to a dentist as well? Because I'm speaking for myself. Should that warrant me going to a dentist as well? Okay, I brushed too hard.
Okay.
Is that a case where I have to go to?
So in some cases, when you brush too hard, yes, you can have bleeding gums. But in some other cases, it's not as a result of you brushing too hard. It's as a result of your gums being inflamed. When your gum is inflamed, it means that you have an early sign of gum disease. That's why you need to see a dentist for that cleaning. The cleaning takes care of that gum disease.
Do you have some statistics to share on how well Nigerians take their dental health?
So if I should use statistics, I think I'm going to kind of like say out of every four Nigerians, three three has never seen a dentist before. Out of every four.
I agree. I'm one of those three.
So that's what I usually use most
Yeah.
times because and that's just the truth. Not just Nigeria, even the whole of Africa.
For people like me who have never been to the dentist, I think people around me, I feel few people have been to the dentist around me. What would you say to convince me? The Nigerians are stubborn people.
Very stubborn.
Yes, I'm a stubborn Nigerian. So what would you say to convince me to go to a dentist? Because so far, if I have a toothache, nothing a little salt water cannot fix after a few days. So what would you say to convince me to?
Okay, so what I would say to convince you, I'm also a very stubborn Nigerian. Let me put that. What I would say to convince you is to tell you that every 10% of plaque that you leave in your teeth, at the end of the day, is going to result in you having a dental issue that will cost you so much money that even you'll be wondering that why did I have to wait till this time? And I'll give an example. The example is that I once had a patient that he said he has never seen a dentist. Even when dentists tell him come to clinic, let us do clean up, he said he does not need it. And he has a lot of plaque and calculus all around his teeth. Until much later, he started having mobile teeth. His teeth started shaking. And I'm like, what's going on? At that point, he now felt like, I think I need to see a dentist. He now went to see the dentist. At that point, he already had, let's say he had like 32 teeth or 30 teeth. He already had about 20 of his teeth that were already shaking. So he needed to take out at least 15 of his teeth.
16.
15 of his teeth, yeah. Because those teeth were already shaking because he already had a severe form of gum disease. So that's why you need to see a dentist at least every 6 months. And you brush your teeth twice daily, very important.
Twice.
Yeah.
So do you think dental healthcare in Nigeria,
Yeah.
those insurance healthcare, do they
Yeah.
cover dental care in Nigeria? And what's the disparity between those that can afford it and those
Yeah.
that can't?
So when it comes to the health insurance, they actually do cover dental care. Not all health insurance cover dental cares, but I think most of them at the moment they've kind of like included dental care, and one way or the other, it kind of helps a lot of people that really cannot afford dental treatment because dental treatment can be expensive. Even me as a dentist, I know it's expensive. So yeah, so the health insurance actually kind of covers it, and in terms of how it kind of helps people in the sense that I know someone that he says that let's say you're doing a clean and polish, which is a cleaning for 60K for just one patient, just 60,000 naira. But when you have an health insurance that covers so many of those things, the health insurance probably pays the clinic a lesser amount of money. So at the end of the day, you get that same
You get
treatment.
the
So
same level
you
of
get that same level of treatment. There's no thing whatsoever. So yeah, it actually kind of covers it, and it actually really makes sense. Something that I usually employ people to do. Though not all clinics take HMOs and stuff like that. Not all clinics take it, but the ones that take it, I usually advise if you can't go there, then you should go there.
So do you think traditional remedies or
Yeah.
all those natural remedies we do at home, do they contribute to the lack of dental care amongst Nigerians? And as well as what are those common do-it-yourself, those DIY remedies we do that are actually causing more harm than good?
Okay, so from the way you're smiling, I think you have like some remedies that you know
I
of.
have plenty. There's plenty I have.
So when it comes to traditional remedies, they actually, at the end of the day, make people not visit the dentist, and by the time they now end up visiting the dentist, they end up spending more money. So an example is someone that uses touch and go, which is one traditional remedy that a lot of people actually do. They just say you're having to take, just put that thing in your mouth. Don't worry, everything's gonna be fine. Usually, what happens is that when you use those traditional remedies, what happens is the pain you're having at that point, you is going to be relief. You get like everything's going to be just a temporary relief at that period. It will definitely come back because it has not yet been treated because it's an infection. It's inside, and by the time it comes back, it comes out worse. I once had a patient that he has always been using so many remedies. Sometimes he even goes beyond those traditional remedies. He goes to get medications, use different kind of medications. At the end of the day, he ended up at accident and emergency clinic. And that's because he had a more severe form of tooth infection. His mouth was swollen. He could not breathe anymore. At the end of the day, we end up losing that patient.
Yeah.
Just from just a slight toothache that he had And that slight toothache is something that even before it had gotten to that toothache, let's say he has gone to see a dentist and they notice that, oh, there's an hole in this tooth. They would have just cleaned it up, done an extra clean it up, and just fill it up, and that's all. You would have not even spent nothing less than even 60K. But imagine it was worse to the theater at the end of the day, they spent a lot of money, but it still passed on from just toothache. Do you get? So all those things don't actually work. Anything that has to do with home remedy, traditional remedy, whatsoever, they don't actually work. Just they will give you a temporary relief, yes, but just go to see a dentist. That's the most important thing. No other thing.
I've actually heard of, I don't know, maybe the statistics
Yeah.
while going through social media, and they said, the lack of dental care actually contributes to heart disease. I want to be
Yeah.
sure, is that actually true?
Very accurate. Yeah, it does.
What kind of case?
So it doesn't just contribute to heart disease, it even contributes to other hormonal diseases like diabetes. And also, there are so many diseases that are linked to the dental health. A patient can come to the clinic and we can know that, oh, this patient has a liver disease from just checking the patient's mouth. Yes, someone can have HIV from just check. I will just see person, like, oh, this person has this particular thing. Do you understand? So when it comes to heart disease, how we entails is that in our mouth, we have millions of bacteria in our mouths. You understand? And those bacteria, we have the bad ones, we have the good ones. That's why we advise brush your teeth twice daily with a toothpaste that contains fluoride. So those bacteria can sleep, they will not be able to do anything whatsoever. So usually when you have a lot of bacteria in your mouth and the load is a lot, what happens? And next thing, you start having bleeding gums. Remember, the heart is like the powerhouse where all the blood supply in the body flows through. You also have blood in your what? In your gum. So imagine the blood that is also in your gum has a lot of bacteria inside of it. Remember, that same blood will still pass through the heart. Those bacteria are also in that blood, and they will get to the heart. And before you know, you start having some heart issues. So yeah, it actually contributes to it.
That's quite insight. Like, I've gotten the confirmation I need that, okay, I might need to see.
You need to. Everybody needs to.
And based on the prices you gave now,
No, those prices are not. It's not fixed.
they're
I just gave it
generic.
randomly.
But from, like, based on the disparity or something, does that cover, like, can that be a situation where, okay, I'll go to a dentist, I want to get something done, and 60K upwards, around that range? Is it possible?
So I won't say it's possible, and I will also say it's also possible. It all depends on what you need to do and the clinic you're going to. You can just go to the clinic and they do a checkup and you don't really have anything that they need to fix, just the cleanup, and you probably spend just that amount or even lesser than that amount depending on the clinic. But you can go to the clinic. Some people just say, oh, doctor, I just want to do a cleaning and check my teeth. But by the time you get to the clinic, the dentist sees your teeth and they're like, wonderful. You have like 6 dental cavities, like different teeth have different holes. You need to do x-rays of each of those teeth. Do you understand that? After then, they need to fill up those teeth. So you would spend more money. So I cannot tell you this is the amount you're going to spend. Do you understand? Just know that at least just go there. Know that, okay, yes, at least you get go there, see for yourself. At least do the consultation. That's like a step. Don't wait until when I usually tell people, don't wait until when you have so much money. At least start from somewhere. Go for a checkup. When you go for a checkup, they tell you this is what you need to do. Plan everything. Okay, do you know what? Let me do this ones now. Okay, do you understand? At least you start with the cleaning before you do every other thing. Don't wait until when you start having one dental issue. A dentist can look at you. You're just talking to him, and he already knows all the things you need to do.
Oh,
wow. But he cannot give you the exact cost. Oh. You get, so it varies.
All right. So, how equipped do you think public hospitals are in terms of dental care? And can you paint a scenario of what it would look like if someone who can't afford a private dental care shows up to the hospital? What do you think?
Like a public hospital, right?
Yes, in a public hospital. Do you think they are equipped to take care of dental care in Nigeria? Most of them.
I would say most, but I think some. I'll use the word some. Some are actually equipped. I will use Luther as an example. You can go to Luther and get your dental care. You can go to Lasot and get your dental care. You can go to I think HSC on the island, the General Hospital on the island, so you can also get it there. They are also equipped in the sense that they have everything you need, X-ray machines, everything. The only thing with public hospitals is the fact that the time that you get to see a doctor might take a long time. You just have to wait because there are so many people down the queue. Do you get? So you might spend probably the whole day as compared to going to a private hospital. But in terms of primary health centers, I don't think we have that in Nigeria. Like, they usually have dental. I don't think I've ever seen a primary health center that actually has a dental clinic. They don't usually have that. So, but public usually does all that. Yeah.
Okay, so coming up on that point you made, do you think the government has, forsaken the grassroots people when it comes to, dental care? Because you said that the primary health care, most primary
Yeah.
healthcare don't have. Do you think the government should do better into looking into that? Because a normal trader or a
Yeah.
keke driver is not thinking of
No
dental
one is
care.
thinking
To
of it
them, it's like a
actually.
cosmetic
Yeah,
issue. It
yeah,
just
yeah,
looks
yeah.
well, waiting might look up. Do you understand? So, do you think the government needs to put more effort into putting more facilities there for the grassroots people?
Okay, so the thing is, in as much as the government needs to put those facilities in primary health centers, we also need to do a lot of oral health education. When I was in school, I did my project was about oral health care literacy and utilization. That is how much people actually utilize dental
Dental,
health. And
yeah.
I noticed that majority of people don't actually utilize it, even though you think that, oh yes, you can go here and just get your treatment. They don't want to utilize it. So I think we need to work more on the education aspect of like let people understand that, oh yes, they need to go for this treatment. Some people can, and there are people that when they have, let's say, a toothache, they see a dentist, probably even a private clinic. But after that toothache, after they've sorted out that one, they will not go back again. They'll tell them, we'll come back in 6 months for another checkup. They will not go back. They'll wait until when they have another one. So it's more of an oral health education. People need to understand that, oh, these things are some things that I need to do. Aside from my normal regular check, I need to also do my dental check. If you check outside the country, let's say the UK, you notice that everybody there, I'll use the white as an example. They know that every 6 months they need to see a dentist. Though there are appointments times, you go there, you see queues of people waiting because you understand, because they know that these days their own day to see a dentist and all. So it's more of like we need to work on oral health education. That's the major thing we need.
Right. So how does Smile Royal Home fit into this
The whole equation.
solution? Yes.
So the way Smile Royal fits into the whole equation is in the sense that Smile Royal, it's more of like a dental outfit that has to do with not just clinic appointments, also does home service. So how we come into this equation is more of people that they feel like, I don't want to go to the hospital. I don't like the whole hospital setting. And let me just can't I just see a dentist that comes to my house, does the treatments for me, does the treatment he can do for me, checks my teeth, tell me the things I need to do. Then I will just know that, okay, and probably the other ones that probably go to the clinic to do all that. So that's when Maria comes in, because there are times that we go for what they call it, home service dental treatment. Though we don't do everything at home, but at least the checkup and some other basic treatment we can do all that there. So that's where we come into play, not just the clinic aspect. So it's more of like home service. Do you understand? So that's just it, at the comfort of their home.
All right. So lastly, if you could put one policy on the desk of the Minister of Health today
Yeah,
and give one piece of advice
yeah.
to every Nigerian listening right now, what would you think?
Okay, so I would put it in two places. Number one policy should be what do you call it? The import of dental materials into Nigeria. It should kind of like reduce it, because when the dental materials in Nigeria, like in terms of import duties and all, when it's reduced, it means that the treatment cost is going to reduce. Because when dental material increases, definitely treatment for patients is going to increase. That's one. And also, I will also tell people to brush their teeth twice daily, because that's the major thing.
Major.
Because one thing about dental health that people need to know is that prevention is better than cure. So brushing your teeth twice daily with a toothpaste that contains fluoride, you notice I've been saying that, because that is very, very important. Because when you don't use that, definitely you're going to have one dental issue or the other. So that's it. So everybody needs to brush their teeth twice daily.
All right. Thank you very much,
You're
sir.
very much welcome.
Yeah, and that brings us to the end of today's episode. I think one biggest great takeaway we have from today's episode is that dental care is not just a cosmetic
Yeah.
issue. It's a huge part, is a major part of your major health care. It's a major part of your overall well-being and all that. A huge appreciation to Dr. Farouk, for sharing incredible insights with us today. I learned a lot. I don't know if you learned a lot from him as well. If you learned a lot today and you enjoyed today's episode, please drop your comments in the comment section box. Also, do not forget to subscribe to our channel, and also do well to follow Dr. Farouk on all his social media platforms. Follow him on all his social media platforms to learn about dental care, oral health, and everything well-being. Thank you for joining us today. See you same time next week. Have a wonderful day. Bye.